Sometimes our bodies respond to a lack of minerals or sickness in very weird ways. Stick around. We're going to share some odd symptoms that you might not understand, but these could signal serious health issues. I know, it sounds weird, but if you often feel a strong need to chew ice, you may have a problem called pagophagia. This usually happens when you're not getting enough of some nutrients. Chewing ice all the time is bad for your teeth and could mean you have a hidden health problem. Pagophagia means you really want to chew ice. If you often feel the need to chew ice cubes, ice chips, or even frost from your fridge, you may have pagophagia. Here are some signs that you might have pagophagia. Your skin is pale and dry, you feel tired, you have headaches, your tongue hurts, your heart beats fast, you feel sad, you feel dizzy. The main reason people get pagophagia is because they don't have enough iron, or they have a problem called iron deficiency anemia. One study showed that out of people who didn't have enough iron, 16% really wanted to chew ice. People with not enough iron want to chew ice for good reasons. When they chew ice, it helps them feel more awake and smarter. If you have an iron deficiency, it's important to take steps to increase your iron intake. Here are some recommendations. Eat iron-rich foods. Incorporate more iron-rich foods into your diet. These include lean meats, poultry, fish, beans, dark leafy greens like spinach, and iron-fortified cereals and breads. Combine iron with vitamin C. Vitamin C helps your body absorb iron. Try to eat vitamin C-rich foods like oranges, strawberries, bell peppers, and broccoli at the same time as you consume iron-rich foods. Cook with cast iron pans. This might seem unusual, but cooking in a cast iron pan can actually increase the amount of iron in your food, especially when you're cooking acidic foods like tomato sauce. Avoid certain foods. Some foods can interfere with iron absorption. These include tea, coffee, dairy products, and whole grain cereals, which should not be consumed at the same time as iron-rich foods. Now, if your toenails grow very slowly or stop growing, it might be because of a health problem that needs a doctor's help, like peripheral artery disease, PAD. PAD is a blood vessel problem caused by plaque buildup in the arteries going to your legs and feet. If you have PAD, blood that carries oxygen can't easily reach your legs and feet. So if your toenails aren't growing like they should, you might need to get tested for PAD. There are many things that can cause PAD and stop your toenails from growing. Some things, like being older than 60 or having a family history of blood vessel disease, you can't control. But there are other things, related to how you live, that can cause PAD and stop your toenails from growing. These are things you can do something about once you understand they're harmful. Smoking, not moving around much, not eating enough good food, high blood pressure, and high cholesterol all increase the risk of PAD because they can lead to more plaque in the arteries. Acanthosis. Nigricans is a skin condition where your skin becomes darker and thicker, usually around your neck. It can also affect your armpits and groin area. People who are overweight or have type 2 diabetes often get this condition. Children with this skin problem have a higher chance of getting type 2 diabetes when they grow up. The dark color comes from too much pigment in your skin, and you can't just wash it off. Acanthosis nigricans is not a disease by itself, and it doesn't hurt or cause any other problems, except maybe you might not like how it looks, but it can be a sign that you might have type 2 diabetes. So if you see that you have this dark skin, you should get checked for diabetes. Some of the other possible causes can be genetics, certain medications, or even problems with the endocrine system. Your breath has an interesting ability to provide clues to your overall health. Fruity breath is a term used to describe a sweet or fruity odor on someone's breath. While it may sound harmless, it can sometimes be a sign of a serious health condition. The most common cause of fruity breath is uncontrolled diabetes. When your body can't use insulin properly, it starts burning fat for energy instead of sugar. This process produces chemicals called ketones. When your body makes too many ketones, it can lead to a condition called diabetic ketoacidosis, DKA, which can be life-threatening if not treated promptly. One of the symptoms of DKA is fruity or sweet-smelling breath. Another potential cause of fruity breath could be starvation or fasting. Just like in uncontrolled diabetes, the body begins to burn fat for energy, leading to the production of ketones and causing a fruity smell on the breath. If you notice a persistent fruity smell on your breath or someone else's, especially if it's accompanied by other symptoms like frequent urination, excessive thirst, or fatigue, it's important to seek medical advice as soon as possible. It's always better to rule out serious health conditions and get the proper treatment if needed. A glossy-looking tongue, also known as a smooth or bald tongue, can be a sign of a vitamin deficiency. Vitamin B6, also known as pyridoxine, is essential for the body's metabolism and the normal functioning of the brain. When someone has a deficiency of vitamin B6, one of the symptoms can be a smooth, glossy tongue. This is because B6 plays a crucial role in maintaining the health of the mouth's mucous membranes, including the tongue. In addition to looking glossy or shiny, the tongue might also appear inflamed or swollen. This condition is medically known as glossitis. It might cause the tongue to change color, becoming bright red, and sometimes cause discomfort or pain. Other symptoms of vitamin B6 deficiency can include mood changes, such as feeling irritable or depressed, feeling tired or weak, and having a poor immune function. Getting enough B6 from your diet is simple. Foods like poultry, beef, and fish are great sources of this vitamin. For example, only 3 ounces of tuna can provide almost half of the daily required B6 for an adult. Similarly, the same quantity of salmon can provide 30%, while chicken can supply 25% of the daily need. If your jeans seem to be getting longer, it might actually be because you're getting shorter. If you notice that you've lost more than 1.5 inches of height since your 20s, it might be a sign that your vertebrae are compressing or fracturing due to osteoporosis. Osteoporosis is a bone disease characterized by a decrease in bone strength, which makes the bones more fragile and likely to break. It is often called a silent disease because bone loss occurs without symptoms. People may not know they have osteoporosis until they experience pain or break a bone. One less known but indicative sign of osteoporosis is a loss of height. This happens because osteoporosis affects the density and strength of the vertebrae, the small bones that make up the spine. As these vertebrae weaken from osteoporosis, they can compress or fracture, causing the spine to become shorter. In order to keep your bones strong as you age, you should eat foods that contain calcium, vitamin D, and proteins like low-fat dairy, leafy green vegetables, fish, and fortified juices, milk, and grains. You should also get active. Choose weight-bearing exercise, such as strength training, walking, hiking, jogging, climbing stairs, tennis, and dancing. This type of physical activity can help build and strengthen your bones. Green pea is a rare symptom of a urinary tract infection, UTI, but a type of bacteria called Pseudomonas aeruginosa can cause your pee to turn green. P. aeruginosa is a germ found in dirt, water, and plants. It can cause different infections and spreads through dirty hands, water, food, and medical tools. People with weak immune systems are most at risk. When this germ gets into your urinary system, it can make your pee green. This happens because it makes a bluish-green substance named pyocyanin that can get into body fluids, including pee. If this germ affects the skin, it can even cause blue-colored pus. If you suspect that you have a urinary tract infection, UTI caused by Pseudomonas aeruginosa, or any other kind of UTI, it's important to seek medical advice. UTIs are most often treated with a course of antibiotics, so the human body can be truly incredible, yet totally bizarre. Your body even knows how to signal that something isn't right with your health. Don't ignore the symptoms.